to nursing prep. Push yourself in nursing preparation with smart way. Cardiovascular drugs. Dobutamine, Dobutrex, improves cardiac output and is indicated for use in all of the following conditions except Option A. Septic shock. Option B. Congestive heart failure. Option C. Arrhythmias. Option D. Pulmonary congestion. Right answer is Option C. Arrhythmias. Dobutamine, Dobutrex, is not used to treat arrhythmias. Choices A, B, and D are conditions that respond to dobutamine. Conduction defects will most likely be an adverse associated with the use of Option A. Verapamil. Option B. Nifedipine. Option C. Diltiazem. Option D. Felodipine. Right answer is Option A. Verapamil. Verapamil, Calin, has the strongest chronotropic effect and will cause a delay in conduction at the SA and AV nodes. Which of the following calcium channel blockers has the most potent peripheral smooth muscle dilator effect? Option A. Diltiazem. Option B. Nifedipine. Option C. Nimodipine. Option D. Verapamil. Right answer is Option B. Nifedipine. Nifedipine has the strongest peripheral smooth muscle dilator effect of all the calcium channel blockers. Other choices have less of a vasodilator effect. Which of the following adverse reactions is found more often in volume-depleted elderly clients? Option A. Bradycardia. Option B. Conduction defects. Option C. Ankle edema. Option D. Hypotension. Right answer is Option D. Hypotension. Hypotension is more likely to occur in the elderly. Choices A, B, and C may occur but are not necessarily increased in frequency in elderly clients. Which of the following calcium channel blockers is used to counteract or prevent cerebral vasospasm? Option A. Verapamil. Option B. Nimodipine. Option C. Nifedipine. Option D. Felodipine. Right answer is Option B. Nimodipine. Nimodipine is given in the neurologic client to prevent cerebral vasospasm. Choices A, C, and D are given in cardiac disease and in the management of hypertension only. Which of the following effects of calcium channel blockers causes a reduction in blood pressure? Option A. Increased cardiac output. Option B. Decreased peripheral vascular resistance. Option C. Decreased renal blood flow. Option D. Calcium influx into cardiac muscles. Right answer is Option B. Decreased peripheral vascular resistance. One of the effects of calcium channel blockers is to decrease peripheral vascular resistance. A, C, and D describe the opposite effects of calcium channel blockers. Jason James is taking sharp S blockers. All of the following should be included in his assessment except Option A. Pulmonary function tests. Option B. Baseline ECG. Option C. Glucose level. Option D. Blood pressure. Right answer is Option A. Pulmonary function tests. Unless the client has a history of pulmonary disease and pulmonary function tests are indicated, there is no need to include this in the routine assessment of the client taking sharp S blockers. Routine laboratory monitoring in clients taking sharp S blockers should include Option A. Sodium. Option B. Glucose. Option C. Thyrotropin. Option D. Creatine phosphokinase. Right answer is Option B. Glucose. Sharp S blockers influence glucose metabolism. Although A, C, and D are nice to have, There is no indication that routine assessment of thyrotropin, sodium, or creatine phosphokinase is needed. Competitive antagonism of which of the following occurs at sharp S receptor sites? Option A. Catecholamines. Option B. Adrenergic sites. Option C. Acetylcholine. Option D. Norepinephrine. Right answer is option A. Catecholamines. Catecholamine receptor sites are blocked by the action of sharp S blocking agents. Adrenergic sites may be blocked, but the more appropriate response is catecholamine receptors. Acetylcholine is not affected by sharp S blockers. Norepinephrine is a catecholamine. Sharp S blockers should be avoided in which of the following conditions? Option A. Bronchoconstriction. Option B. Hypertension. Option C. Angina. Option D. Myocardial infarction. Right answer is option A. Bronchoconstriction. Sharp S blockers should be avoided in bronchoconstrictive disease. B, C, and D are indications for the use of sharp S blockers. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.